lecturer in public health medicine at the University of Exeter, former consultant on controlling the spread of diseases of Public Health England, joins me this morning. Bharat, thank you very much for your time. As expected then, Boris Johnson confirming yesterday England will move to the fourth and final stage of the government's roadmap for lifting lockdown restrictions. This all appears to hang, doesn't it, on the government's contention that we don't really need to be worried about COVID at all now because of the, as Sajid Javid put it, severely weakened link between the number of cases and hospitalizations and deaths. That's where the government is. Are they right to be in that place?
They would like to be there. And I, as an infectious disease control expert, would say I'm very cautious and I remain concerned. So with respect to being cautious, if we look at what our chief medical officer said at the same conference, he said, slowly and carefully do it. And I agree with him that we've got to very slowly and carefully do it, gingerly. And the one thing no one in that room was brave enough to answer and say, including the chief medical officer, including the chief scientific officer, including the prime minister, was if things don't look right, we will have to reconsider and consider local restrictions if need be. It has to be spelt out that there may need to be local restrictions 6 months, 9 months, 12 months from today.
This is the situation at the moment, of course. Before we move to stage 4, we're already seeing cases rocket into the 30,000s. And Sajid Javid says that we could expect 100,000 cases a day by the time we get to the summer. But even before we lift these restrictions, the cases are increasing. If we stayed in stage 3 and if Johnson was to delay moving to stage 4 again, as he did for a month, to what extent do you think that would hold down these numbers that are already rising?
Well, every day gained is a gain in the positive direction. And what I mean by that, the gains come from immunizing at pace as many people as possible, as fast as possible. And I do appreciate that no day is a good enough day to come out of restrictions when we've got a pandemic still ongoing in the rest of the world. Therefore, myself and many of my colleagues are not here for permanent restrictions or continued restrictions, but what we are here for is to say and advise and mention that removing restrictions all in one go is not a good idea, and making restrictions and infection control measures voluntary is also not a good idea.
Such as masks?
Such as masks, indeed. And I find that Prime Minister Johnson finds it very difficult to be categorical. I really don't know. I don't understand. I am not a politician in that bracket to understand why the Prime Minister cannot say it, which is, but we will mandate that in crowded places, you will have to wear your masks because it is an infection risk and we have to protect the population.
But
I don't know why he can't say it.
It's not just that he can't be categorical, it's that he can't tell the truth. He lied 5 days ago, didn't he, when he said that the link between COVID cases, severe disease and deaths had been, in his word, severed by the vaccination program. That was an out-and-out lie. And when Johnson lies about something as serious as this, that is going to have consequences, marginally at least, in terms of people's behavior, isn't it?
Indeed, indeed. And this really worries me because the link has not been severed. The link may have been weakened, and we need to be very watchful. And I hope and pray that the link between vaccines and hospitalizations and severe disease has been weakened. And it looks like it has been weakened, but under no circumstances has it been severed. If it had been severed, I would be saying to you today, happy days are here. Yeah. Get immunized, remain happy, all is job done. That is nowhere near the case.
And is that because we haven't vaccinated all of the adult population, or is it because the vaccines aren't 100% effective, or is it both?
It's both, and a little bit more complex than that as well, which is there is a raging uncontrolled infection all over the world except for the richer nations who've bagged, and this is another tragedy. I feel ashamed to have to sort of acknowledge that the richer nations have bagged the entire supply for 2021 of the vaccines from all the major manufacturers. Therefore, the infection rages uncontrolled in other parts of the world, and we're not well until everyone is well. And if a variant arises from Africa or Asia, it may set us back severely. It may be a variant that bypasses vaccines. Therefore, the issue with the vaccines is they're not as brilliant. They're good, but they're not brilliant. And you may get a variant that bypasses the vaccine. And you also get dropping off of immunity. So it's not like the immunity is there and it's there forever and it's extensive.
And you're absolutely right, of course, to point out that in rich countries, in Western countries, we're doing a lot better precisely because we have those resources, and the way that we've deployed them is arguably selfish and conceivably much worse than that. But I guess within these borders or within vaccinated countries or countries which are able to vaccinate, if we 3 months down the line are able to say that the entire adult population of the UK has been vaccinated, how much of a lift, how much of a head start does that give vaccines in this race against the virus? Will things look different in 3 months, even if the number of cases is continuing to rise?
Well, we will have the vulnerable people, older age group people, the immunized people protected. But there's a big but. Not everyone makes effective immunity. And the older you are and the other pathologies that you have, immune suppression, those sort of things, you make poor immune response. So there will always remain a proportion of the population, despite being immunized, are not properly immune.
When Johnson says, as he has in the past, that this roadmap or this journey is irreversible, will that turn out to be another one of his lies?
That is extremely unfortunate. And when I started off by saying we will need local restrictions, etc., in 6-9 months, etc., that is exactly what I was referring to, which is in communicable disease control, nothing is irreversible, nothing is permanent. You have to act according to what the situation is. And if you, to use the example of Margaret Thatcher's finance minister, Geoffrey Howe, saying the leader has sent us to the cricket pitch with a broken bat. That is exactly the situation here, where if you say irreversible, then people in communicable disease control working for Public Health England, which is a civil service organization, cannot do certain things because they're not allowed to do certain things. And that is not proper infection control. And they, unlike myself, cannot even say that we would like to do these things, but we can't do it because we're not allowed to do it. And then they camouflage it according to, well, yes, but no, but yes, but no, instead of saying we can't do it because we're not allowed to do it.
Bharat, thank you as ever, sir. Dr. Bharat Pankhania, Senior Clinical Lecturer in Public Health Medicine at the University of Exeter, former consultant on controlling the spread of diseases for Public Health England.